This podcast is brought to you by Big Motoring World, one of the UK's biggest used car supermarkets. For more information, go to bigmotoringworld.co.uk. This week's guest is a GP, author and fellow media doctor known for straight-talking health advice and clear-eyed commentary on the NHS and the issues that matter. Welcome, Ellie Cannon.
Nice to see you.
Lovely to see you. Two GPs in the same surgery.
I know.
That's how you get to see GPs these days.
Exactly.
How are you?
I'm really well, thank you. How are you?
I'm very well. You keeping busy?
I'm very busy, yeah, with my NHS practice and obviously health broadcasting all the time. And I have a new book coming out.
Oh, tell me more. What's that about?
So I have a book coming out in September on the topic of the moment, HRT.
Absolutely. What's it called?
It's called The Little Book of HRT.
Right. So all the essentials that people need to know about.
Yeah. So what I wanted to do, I've sort of felt in the last few years, obviously there's been so much talk about menopause, and there's a whole industry now around menopause. And it's actually very hard for your average woman to find just very straightforward, simple advice. What is HRT? What is in HRT? Because there's so much sort of sales pitching going on. Yep. So actually I was asked to write it, what somebody would find if they went to their NHS GP surgery in a normal consultation, not spending a fortune here or buying this off the internet, just what most women can expect to receive if they walk through an NHS GP surgery for HRT. Yeah,
it'll be very much needed and very timely. Now, we're both very experienced GPs, but I've been around quite a bit longer than you. I'm a bit older than you. So I have seen the subject of menopause and HRT go from completely being neglected and women not having any information at all to be, the topic of the year and, over medicalised to a certain extent. Yeah. Where do you feel where do you stand on this?
Yeah, so I feel exactly the same. So actually, my late father was a gynecologist. Okay. And when I was a kid in the 90s, he actually had an HRT clinic. But as you say, HRT and the menopause, it was sort of, people were talking about it a little bit.
So that would have been a breakthrough.
It was quite a breakthrough. But actually then we had obviously the Million Women study and all of these things that made people so terrified of HRT. People still weren't talking about menopause. It's quite stigmatized. And then we've had this huge pendulum swing as you've described. And I think the problem with all of that is that people think HRT is either good or bad. And actually, as we know as GPs, there's no such drug that's either good or bad. Most of them are actually somewhere in the middle. There's a lot of women who can't take it. There's a lot of women who love it. There's a lot of women with side effects. So that's what I sort of wanted to pick through, that actually there isn't a good or bad in terms of HRT and the menopause. It's actually a sort of mishmash of everything and a lot of grey rather than black and white.
Well, every woman's experience of the menopause is different, isn't it? So it has to be personalised to them.
Yeah.
And the more knowledge they have, the better. Now, you were kind enough to send me a review copy, and I was very happy to give you an endorsement in a quote, because it is very straightforward to read. It's very clear.
Thank you.
It's set out in a really user-friendly way, and I wish you every success with that. But it's not your first book either, because there's three here. This one was about parenting.
Yes, that was my first book.
This one,
so that's about
the New Mum's Manual.
Yeah, exactly. So that was really, that was very much a labour of love. Yeah. Labour, get it?
Yeah. I get
labour of love, and I really wanted to write that. So again, very similar to the HRT book, cutting through all the noise of parenting. Everybody who has a baby can look after their baby, but I think especially now, actually even more so, we're sort of made to feel by social media and the industry that actually you need lots of stuff and it's very difficult and this and the other. And this was a very simple baby book, just empowering new parents to say, you got this, they need to sleep, they need to have some milk. Yeah. It's not actually much more complicated than that.
Because remember back in the day when, women used to stay in hospital for a few days after having a baby, even a natural birth, it was straightforward. And they would get advice from the midwives and they would get advice from the health visitors. Now they're sent straight home. And, there's no book that comes with them until now, until this one.
Exactly. And also as well now, I think sort of the way people live now, like people have their communities online. Yeah. You don't have necessarily like your mum and your aunties coming into your house and showing you how to feed the baby or, all of these sort of things. Like I still remember when I had my first child over 21 years ago, I remember my mum coming around every day and showing me how to do a quick wash on the washing machine, just to sort of like, get the baby grows washed quickly. I don't know how much that happens anymore.
Yeah, absolutely. And this book particularly caught my eye. Bad Drunk. We know that drinking is an increasing problem, particularly amongst middle-aged women, I understand. What was this about?
So Bad Drunk is great. So it's actually the memoir of Millie McIntosh, who is the influencer from one of the original Made in Chelsea cast. And Millie had a sort of lifestyle that started at boarding school and with her lifestyle, which involved a lot of drinking, a lot of partying. She admits herself, she had some mental health difficulties and some anxiety particularly, and utilised alcohol, as a lot of young people do, really as a way to mask that. But that carried on. So that carried on into her 20s and even carried on when she became a mum. She's got 2 lovely little girls, and even sort of carried on then where alcohol was a crutch. It was something to look forward to. And she made the decision around 2 or 3 years ago now to go sober. She started off what's called now being sober curious. So she was sort of interested in that lifestyle. And she was very open about it and very open on social media about living life without alcohol. And she was asked to write about it. And actually, one thing you might find interesting, again, we're talking about sort of parenting, which I certainly didn't know. She's obviously had her children very recently. She was saying even now, when you go to parenting events, even little ones' birthday parties and that sorts of things, there's alcohol served. I mean, that definitely didn't happen when I was a young mum. I just sort of found that really interesting. So even in that space, she's had to learn to say no. And so she's written her memoir, and she was sort of very keen that she had a doctor writing with her, because obviously there's a lot of medical aspects to alcohol. Both, obviously, everybody knows about the liver side of things, but also it's a risk factor for cancer. It's a huge risk factor for mental health problems. And so there's a lot of sort of medical aspects that she wanted someone else to write.
Well, it sounds like a great collaboration. It's called Bad Drunk. We talk about bad drunks, the people who don't behave well, their personalities change when they've had a few drinks, as opposed to other people who just get silly and fall asleep. Is that something you sign up to? Is there such a thing as a bad drunk?
Yeah, I think so. I mean, she talks a lot about alcohol stopped sort of serving her. It wasn't actually helping her in the end.
She realised that.
And, she had a lot of anger, a lot of anxiety, a lot of those bad feelings. You're absolutely right. A lot of people are able to drink, and it's a very sort of happy place for them when they've had a few drinks, even when they're drunk. But there are so many risks from being drunk, both in terms of how you behave and your disinhibition, to the accidents people end up in, obviously the risks people take, especially for a young woman. So she feels that she was a bad drunk. She doesn't feel she was an alcoholic. And she was able to stop and really forge a different pathway for herself, which is amazing.
Excellent. Well, you're not just an author. You're on in the media, like myself. You're on radio and TV. What's been catching your eye lately in terms of big medical stories?
Oh, I think we had our first new antibiotic possibly last week for about the last sort of 50 years, as you know. That's sort of, a big one. What else has been around? I think there's always lots of talk about the NHS.
Sure, yeah.
And so it was interesting last week. I was talking on the radio about this idea of having separate A&Es for mental health problems.
Yes.
And I don't know about you, I'd be interested to know what you think. But for me, I feel that that's probably not a great idea because there's so much sort of interlinking between mental and physical health.
I mean, it sounds like a great idea in theory. It sounds like a non-medical person has come up with this gimmick of an idea, because how do you know when someone comes into hospital asking for help whether it is a physical thing that's affecting their behaviour or whether it is purely a mental health issue? It's not as if you can say, right, we know what you've got before you come in, you need to go to that department. They have to be assessed. There has to be some sort of triage. Okay, if they're triaged and then they need some acute medical health services, fine. But to have separate hospitals, I can't see that working in theory.
No, exactly. And I also think we know that people with mental health problems have much worse physical health than other people. So those times of crisis when people go to hospital is actually a really good opportunity to sort out their mental health, or maybe have some blood tests they hadn't had for a long time, or those type of things. And we also know, as you said, that people with psychological problems actually sometimes have a physical illness that's manifesting as hallucinations or anxiety or sort of all sorts of things. I've had an episode myself actually a few years ago where I was incredibly, incredibly anxious, and actually my issue was heart palpitations. It wasn't actually coming from a psychological place. It was coming from something with my heart.
Right. Interesting. I mean, you and I both have issues in trying to help particularly young people with mental health issues get the referrals they need, getting them seen quickly. Sometimes if they are admitted, they have to be admitted to a far-flung place, miles away from relatives. This is a major problem, isn't it?
It is a real issue. There's a real issue with personnel in psychological services and psychiatric services. And I find it quite interesting because I've got children who are sort of university age, and they've got so many friends who are studying psychology or interested in sort of mental health, going to do clinical psychology masters. And yet on the ground, there seems to be very few psychologists available. We're lucky in my NHS GP surgery, we often have a mental health nurse or psychologist working with us, but the turnover is huge and so fast. We feel privileged if they stay for a year. There seems to be a lot of difficulties getting people to work in mental health, despite the fact we're all talking about it all the time. And you're absolutely right. I mean, if I've got patients who have got acute depression or maybe an acute eating disorder, it feels like a struggle to get them seen, whether it's children or adults.
Yes.
And that definitely hasn't got better.
Well, we'll take a short break there. This podcast is brought to you by Big Motoring World, one of the UK's biggest used car supermarkets. Their mantra is, we're big on what matters to you. They're big on choice, service and value. They price check their cars every day to give a best price guarantee with up to 95% of cars priced below market value. Search bigmotoringworld.co.uk to find your nearest store and for terms and conditions. Well, we were talking about personnel earlier, weren't we? We were talking about how young people who are passionate about studying medicine get into medical school. It was different in our day.
It was.
In our day, we were interviewed face to face. We could express our thoughts. We could express our personalities, if you like. They could assess whether we were good communicators, people. These days, it's all psychometrics. And as you were saying, unless you've got 3 A stars in science subjects, particularly, you don't really have a chance. And yet we know 30% of doctors who qualify never practice medicine because it doesn't suit them. What's your take on that?
Yeah, I mean, I do find this really interesting. I'd say it's one of my sort of current bugbears.
Yeah, mine too.
Is what has happened with all the people going into medicine. And as you say, the other end, we've got 30% of people leaving, which, I mean, definitely wasn't like that when I qualified 25 or so years ago. What strikes me as very odd is that it is, at the end of the day, medicine is still a vocation. You still have to really like people and want to help people and care for people. Even if we're using AI and even if we're using robots in surgeries, whatever we're doing, we know you still have to want to help people. It's inherent in our nature. I'm still the person on the aeroplane who gets up to help. We're those people, and you have to be those people.
Sure.
I think, to be a doctor. And as we were saying, when we got into medical school, of course, you had to be dedicated, but you didn't have to be the top A star. Now I've watched my kids' friends try and get into medical school. And I say try because even the brightest kids with the A stars at GCSE and A level and lots of work experience and the right schools, they are struggling, and it's nowadays considered lucky if you have one place at medical school, and you don't even think about wanting to choose where you're going to go.
No,
I mean, there's no. If you get a place, you take it, you go.
Absolutely, you don't have a choice.
And it's obviously it's competitive, and people want to do medicine, and of course you have to be dedicated, and you have to be able to pass exams, but we must be doing something wrong if we're making it so hard for those kids that really want to do it and are really dedicated. We're taking a cohort in, and then, as you say, at the other end, 30% are out the door.
It doesn't suit them, yeah, that's right. You're quite right about the doctor-patient relationship and communication skills. Empathy. Empathy is something that we underappreciate. I'm thinking of changing the name of my house to Bedside Manor just for the sake of it, because everybody needs one, don't they? A bedside manner, sitting by the edge of the bed and saying, what's worrying you? Tell me what you're most concerned about. I'm not going to say what treatment you should have. What do you want? What do you expect? And I think that's really important. But you're quite right. I think you can almost be too bright, too academic sometimes to practice medicine, because it's not just a science. There's an art to it.
100%.
And
Absolutely.
experience is so important. So many things have changed in medicine, though, haven't they, in general practice? Would you still choose a medical career if you were starting now?
Well, I'll answer that question in reference to what we just talked about, because I'm a massive empath. So I take on board other people's sadness and pain. And that's always, I suppose, what I wanted to do. Not feel so sad all the time about what sort of people's illnesses, but definitely I wanted to be a doctor. So as I said, my dad was a doctor and he was obs and gynae, as I said, so he delivered babies. And when I was little and he used to be on call, I used to go to the hospital with him and see all the babies on his postnatal ward round. And I actually went to medical school because I wanted to look after those babies. Lovely. And be a paediatrician. But being the overly empathic person that I am, I found that far too hard, looking after kids who suffer. So general practice was, I think, the next best thing, because I still get to see lots of kids and lots of families, and it's not quite so tough on my poor heartstrings. But I think I would, but I appreciate that it's also, it's very difficult. You can't now choose, as we've said, you can't choose pretty much which medical school you go to. You can't choose which area of the country you work in. So there's lots of stories now about sort of people qualifying and looking for what's called training numbers, so to specialise, and actually their family's here and they've started a mortgage and they're given a job somewhere else. Well, and that's why I think that feeds a lot into then why we have strikes, because it's not like people who are junior doctors are sort of paid fortunes, so it's fair enough to go and live somewhere else. So I think that sort of leads into the discord, really. Yes. And to people feeling sort of really infantilized and sort of invalidated.
I think the job has changed fundamentally as well. I mean, when I started off in practice, I used to do my own minor operations.
Wow.
Which was satisfying.
Yeah.
We did our own obstetrics. We did house calls more often than are done now, not just on people who were terminally ill, but we used to see people at home with much less serious
you'd
conditions.
go when I was a kid in the 80s and 90s, the GP came round if you had chickenpox.
Yes, that's right.
To say, that's chickenpox.
And I was on call every fifth night and weekend on top of the days either side. And it was tiring, but it was the adventure of it. We would often be at an emergency before the ambulance. We would call the ambulance when we got there if it was needed. So we would treat heart attacks at home. We would treat strokes at home. And I think that element has largely disappeared. So GPs are sitting in a surgery, seeing a conveyor belt of patients with their complaints and looking at a screen. And, I was lucky enough to spend some time abroad in Shetland and Tristan da Cunha in the South Atlantic. Exciting, using all your medical skills.
Yeah.
And it's pretty rare these days.
I think that's right,
actually. I think medicine has changed a bit.
Yeah, I think you're absolutely right. When I think back to when I was a junior doctor in hospital medicine, and as you say, it's that very sort of practical medicine. It's very exciting. You're all together in the middle of the night. And as you say, you have to think on your feet. You have to use your skills. That is very different to the office-based job that now, and I think now about my sort of GP surgery, where sometimes I've sat in the chair for 2 or 3 hours and not, and not stood up. And yes, you're right. Even when I sort of qualified as a GP around 2007, we did a lot more house visits. We did a lot more medical medicine. People may not realise in general practice now, in NHS general practice, unfortunately, and this probably also explains why people leave, there's quite a lot of paper pushing. So helping somebody to sort out their referral, or people don't really have as we've said, the sort of advice and communities that people used to have. Even things like citizens' advice bureaus aren't sort of around so much anymore. So people come to their GP to ask us about housing, to ask us about their kids' school, so lots and lots of these different things. And you're right, that isn't sort of, it isn't sort of knife on flesh medicine, is it?
Absolutely. Now, you and I both are passionate about public health messaging, public health awareness of symptoms. So we're teachers in a way, in the media, saying, look out for these symptoms. If this happens, do this, and empowering people with knowledge. And that's fine as far as certain things go. But we're constantly battling, not to just increase the knowledge of those people who are interested, but we need to reach people in deprived areas, less educated people. That's always been about. I mean, we've improved awareness enormously. So people are coming to the GPs earlier with breast cancer, with colon cancer, with cardiovascular problems, HRT. So that's great, but we've still got a long way to go, and we're still both practicing as well. So I wouldn't want to lose that face-to-face element, which so many people complain about now. Can't get to see my GP for 3 or 4 weeks at a time.
But I think one of the people don't realise, one of the reasons you can't get to see your GP is often because, again, with the change in medicine, more people are in the GP surgery for not the wrong type of things, because that's unfair, because I've got nowhere else to go, but definitely different types of things to 20 years ago. So people aren't coming in with chickenpox and this and that. They're coming in asking you for a letter to cancel their gym membership. So that there is a lot of that as well. But you're absolutely right in terms of the public health. And that's why, I've always, I love what you do in the sort of, mainstream media. And I've also obviously always done that with the type of media that I do as well. And that's where we need to be. I love watching the sort of health awareness campaigns that are done on daytime TV or on the soap operas. They've done some quite good ones.
Storylines are great, aren't they?
They've done some on the soap operas, about sepsis and about miscarriage, and that's how we get into people's hearts and minds, because that's what people see. There's no point, as you say, preaching to the converted.
Absolutely. So what do we need to do to keep the NHS in its beloved position that it still holds, despite the criticism that it's increasingly getting? I mean, it is under a lot of strain. I don't like it when politicians say it's broken.
No,
it's not entirely broken. It's still wonderful in many, many places and instances, but it is creaking. How do we protect it?
Well, I think there has to be a bit more personal responsibility. I think the government have tried that a little bit with actions like Pharmacy First. So rather than going to your GP with a sore throat or a UTI, actually you can go straight to the pharmacist. They can prescribe that type of thing. I think it's good to get medicine out into the communities, like we saw, in COVID. We took vaccination hubs to churches and to religious centres.
We started regretting selling all the cottage hospitals that we once had 30 years ago, which did a great job. Exactly.
So I think, above all else, we need to sort of try and protect general practice. I know it's sort of quite controversial about having the different types of healthcare professionals in GP surgeries, but my experience of that has been very positive. I work with pharmacists, I work with a physician's associate, and actually having that broader knowledge is actually
one-stop shop is so much more convenient.
Has actually been very, very good. I also don't like it when they say the NHS is broken, mainly because I think it stops people accessing help because they think, well, I'm not going to get any help.
Yeah, true.
So people think, well, mental health services are terrible. The health secretary just said the NHS is broken. There's no point me trying to get an appointment. And I'm sure you find this as well. You'll often have patients who'll come back and say, I can't believe I got seen so quickly.
I know.
Or I can't believe I had this.
Yeah, absolutely.
And you're like, no, actually, that is how it is supposed to work.
And it's still staffed by the most wonderful people, isn't it? People who really, really care.
Definitely.
And go over and above the call of duty, really. Do you think the NHS tries to do too much, tries to offer too much sometimes?
Possibly. I think, possibly. But I think it's hard to, it's hard, I suppose, to distinguish between what's a very important health need for one group and what's a very important health need for another. I think I don't know enough about it, but I certainly think there's obviously too much management and too much sort of like people doing jobs almost for the sake of it. I think we'd probably both find that if we had a look at sort of who works in a hospital or in NHS management. But I suppose it would be hard to say.
It's hard to take anything away.
And we have done over the years. It's interesting. We've rationed over the years. You said you did sort of surgery when you first started, presumably sort of minor surgery, lumps and bumps type thing. You can't get lumps and bumps removed now on the NHS. And actually, I'm not even sure how I feel about that. I'm not sure if that's a good thing. I think that's a shame.
It's a shame. I used to love doing it.
You can't have verrucas treated now on the NHS.
Or earwax removed.
And actually, although they're sort of like funny, odd, very minor conditions, actually they can have a massive impact on someone.
Absolutely.
Especially earwax. I mean, if you're sort of like already slightly losing your hearing and your ears are bunged up with wax, you could go down to 50% hearing.
Absolutely. So you've got 3 books and a 4th one coming out in September on HRT.
That's right.
Have you thought about dabbling with fiction at all?
No, because that is what you do so well. And when is your 3rd book coming out?
The 3rd one in the trilogy is coming out at the end of July. Under Darkening Skies.
Fabulous.
And actually, that has a medical flavour. It's a novel. It's a romance, if you like, but it's also about the production of penicillin. just prior to the Second World War.
I love that.
So I think I'll certainly get you a copy. I'd be interested to see whether you like it or not.
And does Fleming himself feature?
Well, Fleming, he does feature, but he won't. If he would be turning in his grave, because I don't give him the credit. Fleming did not know what he'd discovered, in my opinion. He found a mold, but he didn't do anything with it. He didn't carry out toxicity tests. He never used it as a therapeutic agent. It was the team in Oxford, Flory's team, that's a large theme in the book.
I love that.
So I think you'd like that.
I really will like it.
But a lot of doctors write fiction increasingly, and I think because they meet a lot of patients and get a lot of life experience. And I think you should probably have a think about something fictional. I think you'd be good at it.
I'll keep you posted.
Keep me posted. But I love your positive take still. You're passionate about looking after patients. You still care. When people suffer burnout in medicine, they can stop caring. And I always say that, if a doctor's not enjoying his job, stop doing it. The patients need doctors who care and who are full of empathy. So thank you, Ellie, for sharing your thoughts with me. I look forward to the book.
Yes.
And I shall take one of these home with me.
Thank you.
If you'll sign it for me, and keep up the good work.
So nice
Thank
to
you
see
so much.
Thanks, Hilary.
Thanks, Ellie. Don't forget you can watch all my interviews on the Dr. Hilary Show YouTube page, including my recent conversation with Angela Rippon.
It's a hideous disease, dementia. One of the documentaries that I made about it, I had the privilege of going to the National Brain Centre, where people very kindly donate their brains after death, healthy brains and diseased brains. And it was fascinating, Hilary, too. You will know this as a doctor, but to have in my hands, as I say, such a privilege, to have in my hands a healthy brain, which is pink and solid and heavy, and then to have in my hands the brain from someone who died of dementia, which was shrunken and shriveled and light. And when we cut into it, the healthy brain, and again, I never mean to sound disrespectful with this, but I can't think of any other way of describing it. A healthy brain looks like a pork chop. It's thick and it's solid.
That's right.
Because everything is working. The dementia brain looked like a piece of lace because there were holes in it. You can physically see what the disease does to the brain.
Once again, don't forget to subscribe on YouTube. Do it right now. Make sure you watch the next episode, and let's talk about what really matters to you and your health. For more information and show notes on all our programs, just go to drhilaryjones.com.